I have the privilege of introducing Tim. I've known Tim for many years. We both work together in more than just one company. So definitely I suppose you can call it a plus. Tim is the privacy official and HIPAA program manager or director for Molina Healthcare. Molina Healthcare, a large Medicaid health plan payer here down in Long Beach. I'm not going to read his bio, you guys can read it, but I really think that Tim can articulate very well the privacy issues that are addressable not just from a payer perspective, but also from a provider perspective. He can come across and give you some very strong snippets about how do you really take privacy to the next level. I learned a lot from Tim, and Tim, maybe you can teach the rest of the folks some more. Go ahead.
All right, thank you, Sri. Yeah, get my presentation up here.
Should we follow it?
Thank you. So while we're getting the presentation up, if you could just get a quick show of hands, how many of you are security pros? Okay. How many are privacy professionals? Anybody? Okay. And then rest of you just kind of other application or IT folks generally? Okay. So I'm a privacy guy. So this is going to be about Goin Mobile, and it's the privacy security implications of the mHealth revolution. So I think, we're really on the cusp of tremendous changes that are happening in healthcare, and there are a lot of privacy security implications. So there's tremendous promise with the mHealth revolution to improve outcomes, decrease costs. I mean, again, that's really the holy grail, and something the industry continues to struggle with, of course, is affordability, right? And also having better outcomes, better return on the massive dollars we spend in healthcare, right? Because we're looking at basically a $3 trillion healthcare economy. So mobile health, it's a tremendous promise, but if the privacy security is not managed properly, right, it's ultimately about trust, and if consumers don't trust that their data is going to be secured and private in the mHealth world, then they're not going to want to opt into that, right? And it really is something where they need to be presented with transparency as to how their data is being used, where it's going to, and then they get to make informed choices about that. And again, if the trust factor is not there, we will not realize the return that we could get, which is critical for us. So looking at today's discussion, just going to go through where we are in terms of the rise of the mobile revolution, and then look at that from the mHealth perspective in terms of how all these factors are coalescing in this tremendous mHealth revolution. What are some of the options you might have as an organization, or your organizations would have for implementing mHealth, and then really look at the privacy security issues involved with mHealth. So no secret to all of you on this, but we really have where mobile's taking over the world. And this past year, we had a tremendous inflection point where there were more mobile devices sold and shipped than PCs. So you basically see where PC industry is starting to show some decline, but you have where the mobile industry is still going gangbusters, and Apple, of course, the most valuable company in the history of the world, and really, they can attribute that to their tremendous success with the iPhone and the iPad. And on the other flip side of that, you see where Intel, Microsoft are not as strong as they were 10 years ago. So when you look at America, again, just tremendous amount of penetration of the smartphone market. This data is actually even a little bit old, so undoubtedly the numbers are higher today, but basically 2/3 of Americans aged 18 to 29 own smartphones, And also, if you look at that in terms of higher income folks, probably 70% of those do have a smartphone. And half of adult Americans have a smartphone, so tremendous penetration there. And then when you look at kind of how the market's shaking out, you really see where Android is going to be the number one shipper of smartphone products, iPhone next. BlackBerry continues to show decline. You have a new player really with Microsoft that's improved their Windows phone with Windows 8 for phone coming out, and obviously Microsoft with their Surface tablet is looking to be more of a player in the mobile device market. And really, again, one of the major changes is the tremendous penetration of apps, and in particular for Android and Apple devices, where apps are such a key part of the overall user experience and brings tremendous new functionality to the mobile environment. And the amount of apps that people have on their phones is amazing. People have 50, 60 or more apps on their iPhones and Android devices. And the amount of apps that are available is just staggering. There's just incredible number of apps that people have downloaded over the past few years. So using smartphones, again, just used for a lot of things you'd expect, email, internet, and a lot of people do most of their online activities via their mobile devices. Again, that's a change. People aren't sitting at home in front of their PC doing these activities. They're out on the go, at soccer games for their kids or wherever, and they're able to do a lot of very rich computing out in a mobile situation. So the other part of the mobile revolution is the addition of new devices like the tablets, specifically the iPad, which has been the dominant player in the tablet environment. And so again, you see where tablets are beginning to really replace laptops, both at home and at work. And so that's resulting in, again, less PCs being shipped and less use of PCs. And again, it kind of fits more, really, you think about it, with how we humans are meant to live. Humans, by definition, our body is kind of built to be up and being mobile, ambulatory. And tablets, smartphones, they really are a more natural fit for us than sitting at a desk. So again, they're easy to carry. And again, I'd say the quick boot up is really something that's a tremendous advantage with the iPads and why people love them. So again, mobile content usage, people listen to music, they play games, they surf the web using their browser on their smartphone, social media, text messaging, again, all things that are not going to be surprising to you all. So kind of the implications here, and I'm going to be focusing the rest of the presentation on the second implication, which is really the consumerist aspect. But as all of you with your enterprises undoubtedly see, that you're having to manage a lot of consumer devices now. So that's referred to in the business as the consumerization of IT, and where you're having to manage iPads, iPhones, devices which were really developed for consumers, not for the enterprise, and kind of then retrofit enterprise security onto those devices. And that's a challenge, right? So if you didn't have enough work already, now you have to think about and come up with a game plan for your management about how you're going to secure these devices. And that includes things like BYOD, right? So now where people, they don't want to have a BlackBerry. Blackberries aren't cool. They want to have their iPhone, use that for work. And so a lot of companies doing the BYOD thing. And of course, that represents a lot of issues in terms of security, but also even employee privacy, because now the enterprise, you're responsible for the data on that device and protecting that. Like Sri mentioned, it's really about the data, not the device. To do that, you've got to now monitor what's going on with that person's personal device. So there's some tension there between the employee's kind of own personal privacy issues and then the enterprise's obligation to secure their data. But consumerization of IT also means that you'll probably be developing apps for your own workers, particularly the clinical types of workers who are out in the field or out on a hospital floor. And so again, that gets you into, as an organization, doing software development of mobile apps. When you look at what I call the IT iteration of consumers, that's where consumers, through the mHealth revolution, are increasingly going to be using data as well as computing power, like smartphones, iPads, to empower their own health. And so this is really going to be important, because I think that many of your organizations are essentially going to be involved with app development for mHealth applications. And again, that raises a lot of privacy security issues that we'll talk about in the next section of the presentation. So with the mHealth revolution, as I mentioned earlier, we really have what I call a perfect storm here, and that's where you have many different key factors that are coalescing. Some of that is the tremendous advancements in the smartphones. So you really have these powerful little computers that consumers now have. You have broadband mobile networks with the 4G and the LTE networks that are making mobile much quicker data downloads. You have big data, so we have these tremendous databases of information, including health information. We can data mine that to help come up with better interventions for members and patients. And then another key piece of this is the tremendous sort of rediscovery of some things that B.F. Skinner studied back in the 50s and 60s, and he was sort of fell into disrepute, but now he's being rediscovered, and that is this whole field of behavioral economics and behavioral modification. And so specifically where we are going to help patients and members change their behavior, adopt better habits, and there are tremendous advances that are happening here. And the wonderful thing with all of these things coalescing is they give an affordable platform to do these sorts of things, which previously have been only available, say, when you talk about weight loss, expensive weight loss clinics. So it might cost anywhere from $3,000 to maybe $15,000 for an individual to go off and be involved in a weight loss program that has counselors and whatnot. Through the mHealth revolution, the cost of really having somebody in a program like that can become pennies or a few dollars versus thousands of dollars. So this, again, holds tremendous potential for improved health outcomes and savings. But again, privacy and security is going to be very important to making that come into being. So when you look at increased consumerism in healthcare, all kinds of things going on. So personal health records, remote diagnostics, telemedicine. There was a discussion in the last session about using Skype for basically patient-doctor interaction. And so you'll see this again with more internet, mobile devices for personal health purposes, and that includes apps on these mobile devices, patient portals, things of that nature. So an example of this is basically, again, these weight loss programs. So what is right now probably the #1 public health problem that we have in America? Obesity. Okay, obesity is the #1 problem. And really, we know how to effectively get people to lose a lot of weight. And it's basically through diet and exercise, right? And so it's getting people to change their habits. And this gets back to really the advances in the behavioral modification. But what somebody needs is support to do that. They need to have an efficient way to track their data, right? A scale, so they're tracking their weight every day. They're tracking what their caloric intake is. And they need some support, right? They need support of counselors. They need support of peers, right? It's very helpful if you're trying to achieve a goal, if you have a group of peers that you can share that with, kind of share your goal, share your progress. So we know how to do that. There are examples of out there today of effective weight loss programs, but they typically have cost thousands of dollars and they also take a lot of time, right? So for someone to go off to a clinic for 2 weeks, who can do that, right? You have obligations, work, family, et cetera. So mobile health can basically take all of these things, put them onto a mobile app, right? And then you can have where people track their weight loss. You can have a scale at home in their bathroom that has a Bluetooth connection. That data gets stored in the app. They can take their smartphone, read the barcode of a product at a grocery store, maybe take a photograph of it, and there's the caloric intake, right? So really, these smartphones can do everything that would be done through a very expensive, professionally managed weight loss program. And the potential savings on something like this is in the billions of dollars. Again, when you look at the cost to the United States healthcare system of obesity, it's in many, many billions of dollars, probably hundreds of billions of dollars. So if we can just even shave off 5 or 10% of the costs related to obesity, it represents tens of billions of dollars. Now, we have 50 million Americans that are overweight, okay, that are obese. We don't have enough counselors that could manage 50 million Americans in weight loss programs, even if we had the money to spend. So really, you're looking at mHealth as probably being the only viable solution to America's obesity problem. Okay, so tremendous opportunities, tremendous potential here. And there are similar cases that have been looked at in terms of elder care. Again, huge amount of dollars spent on elder care, potential savings through automation using mHealth on the elder care. Some estimates are $30 billion. So what happens when you get into then the smartphone situation is it's a complex ecosystem. It involves a lot of players that we in our kind of healthcare enterprises haven't necessarily had to deal with as much, right? Again, it's been more of a consumer-based industry. And so when you look at kind of where we've been and where we might be going, when you look at yesterday's sort of pre-iPhone cell ecosystem, you had minimal personal data. Everything was really a closed system controlled by the carriers. The apps that were available were virtually nothing. They were all managed by the carriers, say Verizon Wireless, AT&T, et cetera. And the operating systems, nobody knew what they were, right? I mean, you had things like Symbian and stuff like that. There was no consumer actually had any awareness of it. And you had, fairly limited bandwidth on the wireless network, 2G, maybe 3G, maybe a camera, GPS. So not a lot of bells and whistles. You move into today's smartphone ecosystem, again, that really started, I think, in 2007 when Apple launched the iPhone, right? That kind of changed the whole world, particularly when you talk about the apps. There really weren't the kind of apps available for consumers until the iPhone and the iTunes store went up and they offered all these apps, and that's just grown exponentially. So you look at today's smartphone ecosystem, you have a good web browser on there. There's a lot more personal data that gets stored on these devices. And you have a better bandwidth on the networks. You also have the phones are equipped with Wi-Fi. So folks can go to a hotspot, have connectivity through Wi-Fi. They're not just taking up time on their wireless network. You have new things added in terms of storage on the devices, et cetera. So a lot slicker, but the key, really one of the key differences there is the apps. You have, again, just incredible array of apps that are now available to people, and really a much more consumer-friendly type of situation, a lot more consumer choices. And then as we kind of look tomorrow where things might go, lots of the same features in today's environment for smartphones. But in addition, what you'll, I think, see is where there's added to the hardware on the device, things which are hardware device enhancements specific for mHealth. So things like sensors. So the smartphone can track how many steps somebody takes in a day. Connectivity perhaps to other devices around somebody's home that are tracking things, whether they be scales or other types of home type of equipment that someone has to help manage their health care, and a lot of that data then can come into the phone and into some other place where that consumer, perhaps up in the cloud, is storing all this data about themselves. In addition to that, you're going to see where these smartphone apps begin to be able to have algorithms that will be able to provide some of the personalized coaching that someone could get through a counselor, right? So for example, if someone finds that their exercise program, they're more likely to get out there and take a walk if they do that with a friend, you know, the counselor is someone who might be able to advise the patient that is going to be, make them more likely to be successful with their weight loss program. But we don't, again, have enough counselors to manage all the people that have an obesity problem in this country. So what we need is where we have smarter algorithms that can tailor these recommendations based upon the data that smartphone is picking up and providing back to the app. And in addition, again, we'll continue to see more open systems, more consumer choice, and even more options for consumers, and more health information probably being stored on the device and transmitted to different service providers or app developers. So when your own organizations, you're looking at different mobility initiatives, and how many of you right now have mobility initiatives in your companies? Okay, so probably most of you have them going on and kind of in their beginning stages. And really when you look at that, there are really a couple of options. So one is a mobile website. The other is going to be a native app. And I think sort of bottom line here is that probably user experience at this point would push things more towards the development of a native app, because the native app is going to give a richer user experience. Today, still a lot of the browsing on wireless networks tends to be a little bit slow and not user-friendly. Now that has, again, a lot of privacy security implications, because it's always better to store the data up on a secure network, right, as opposed to down on one of these little devices. But with a native app, you're going to have probably personal health information that gets stored down on this device, and that has a lot of security and privacy risk associated with it. So when you look at, again, mobile apps, this is very important that currently right now you really have a lack of standards in the country. I don't know has anybody read the Consumer Data Privacy in a Networked World paper that was put out by the White House earlier this year? Okay, so it happens to be a very significant issue. The FTC, as you probably know, is yet one of the other regulatory bodies that is very involved in data protection issues. So from a HIPAA perspective, obviously we know about OCR, the Office for Civil Rights, but everybody should have the FTC on their radar of regulatory bodies that represent potential enforcement. And FTC has actually joined with OCR in bringing enforcement in a couple of cases, one, for example, against CVS Caremark. They have a mobile team there at FTC that focuses on mobile issues. And what you've really had is fundamentally a lot of lack of transparency in the whole mobile business. The mobile industry has very often operated with some, I would call them, questionable ethics. And those include examples like this with Path, which is a popular photo sharing app where it basically scraped user data off of their iPhones without any kind of transparency or consumer notice, right? So somebody thought, hey, here's this cool photo sharing app, I download it, and then it turns out that Path is taking all of their contact information and throwing it up onto their server, probably sharing it with other third parties like ad networks and people like that. So there have been several lawsuits that have been brought, class action lawsuits against people like Path or companies like Path. And this is really something, as you get into mobile strategy, mobile development, you really need to be aware of these types of issues, because what you don't want to have is your own brand gets really damaged by partnering with somebody that engages in these types of tactics, right? And when you do your own apps, you want to make sure that you're being very transparent with your customers as to what data you're going to use and collect, okay? And again, back in December 2010, the Wall Street Journal did a series of articles. I think the title was What They Know About You. And they did some research. They examined 101 popular smartphone apps, and again, basically found same thing. Most of these apps transmitted data, off of that person's device in ways that really were a surprise, weren't adequately disclosed. Okay, so this is still going on because you basically don't have much regulation in this part of the industry right now. So it's very important to understand how the data flows around. And really, one of the key features of the mobile environment nowadays is the very important part of, if you kind of look down in the lower right-hand quadrant there, the ad agencies. So almost all of these smartphone apps are taking data and they send it on to these ad agencies because that's really the economic model, right? When somebody makes an app available for free, let's say it's Angry Birds, okay? Hey, how does somebody make money off of that? The answer is online behavioral advertising. So they're tracking this stuff, and very often the phone's unique identifier is a part of the data that's transferred, okay? So lots of issues here that, again, it's very important that you understand these data flows because you need to make sure you're doing the right thing by your patients and health plan members. So again, some of the key points here, just there's a lot of data that gets transferred around, and when you have mHealth and you're the sponsoring organization of an app and you're a covered entity, ultimately you're going to bear the responsibility for making sure that that individual has been given adequate notice about what data is being used and who it's being disclosed to. So that, again, it really comes down to being very transparent with the notifications given to consumers. And guess what? That's not easy when somebody's looking at a 4-inch screen, right? How do you translate a privacy notice, which is, again, probably meant to be printed on an 8x11 sheet of paper, onto a 4-inch screen? So some of these things, again, just how they're designed, there are some challenges. And again, you do have where consumers do bear some responsibility of understanding what their choices are and making sure they're making educated choices. This is just an example of how the mobile kind of ecosystem can collect data. So once a smartphone gets booted up, basically you're going to have the OS. It's going to know the smartphone's location because almost all smartphones have a GPS, right? Not something that's typically in a laptop computer or a PC, but it's in virtually every cell phone or smartphone. They know the unique ID on this phone, okay? And then you have these other components, such as the camera. How many people knew that when you take a photo with your smartphone, into the metadata of that photo is the location where you took the photo? Right? So now you're on vacation, you do that, you upload some photos somewhere, maybe to Facebook or some photo sharing Flickr. Somebody can go in there and actually see where you are because of the metadata that shows the location. It's kind of what was, I think, in the PCI portion, you're talking about you need to make sure you're not using the default settings, right? Most of the default settings on mobile devices are ones that do not protect privacy. Okay, something else to be aware of. So again, lots of tracking going on, lots of things that enable other companies to track what's going on. So again, privacy, really important to be transparent with consumers about the use and disclosure of data, the context of which that data is being used and disclosed, and then making sure that there's a privacy notice and that consumers have a choice. And in particular, I think in our business, very often that's going to be more of an opt-in versus an opt-out. All right, so somebody is affirmatively opting in, and then of course the data security. I would suggest that you have some sort of formal mobility governance within your organization. It's not just sort of pushed off into kind of a skunk works of people that want to work on the latest and greatest thing, and you know, it's kind of off the radar in terms of your formal governance. It's really important that there be governance by the business, and I think that includes, you know, your privacy officer or privacy official on these issues. Otherwise, you can end up probably in a bad situation. You need to have app development standards and making sure that you're, again, building privacy in from the get-go. It's not an afterthought. That's, again, typically very common is privacy security are afterthoughts rather than being sort of baked in to the recipe from the get-go. And if you're not familiar with it, would suggest everybody to basically Google privacy by design. This is a really important structure framework for baking in privacy into your applications and your systems. The lady is Anne Kavukian. She's Canadian. She's the Information Privacy Commissioner for the province of Ontario, very much a leader in terms of privacy. And this is a framework, again, is mentioned in the White House's white paper, the Consumer Data Privacy in a Networked World. So there's quite a bit of traction that this framework has with federal regulators, including the FTC. There's currently quite a bit, again, a gap in that mobile industry in terms of the privacy security laws. One of the problems we have with privacy and security is it's a patchwork. Whenever you have a patchwork quilt of regulations and laws, you're going to have gaps. And so there are gaps. One of the ways the federal government is seeking to close some of those gaps is by having the industry engaging them in a multi-stakeholder process to develop enforceable codes of conduct. So, for example, mobile developers, Apple, Google, they would agree to these enforceable codes of conduct, and if somebody violates those, the FTC would basically be able to come in and take action against them, okay? But that's a work in progress. Obviously, in the healthcare space, we have HIPAA, and so we, you know, with HIPAA, we've got some requirements that are addressable to encrypt data on devices, you know, when it's at rest, and then also where data is transmitted over electronic networks. And again, most of these things, even though they're addressable at this point in time, most people would say you're crazy if you're not encrypting PHI over a network or you're not encrypting it on a mobile device, right? So again, a lot of this, just like with PCI, these are the same standards, the same framework, but you need to apply them now to the mobile environment. So when you look at development of these systems, again, even these small mHealth applications, you need to have robust security. You need to also think about these things, data inventory, risk assessment, the training, other controls. So again, some examples would just be if you have an app that you've deployed to your patients, you need to think about how that data is going to go from that consumer's device over a network back to your servers or to whoever is collecting that data on your behalf. So obviously you need to be thinking about how that data will be encrypted when it's transferred. Most of this data, you know, will be potentially intercepted. Again, as consumers store PHI on their own devices, you need to think about how you're going to educate them, make sure that they're protecting that data that you're sort of encouraging them to store on their own mobile device. And this gets back into it's better if the data is obviously on a centralized server managed by an enterprise as opposed to being on a device. And then, of course, you need to think about your supply chain. So people that you might be hiring to do development, or if somebody's got an app already, you know, you just want to buy that off the shelf, you need to do your due diligence, make sure they're a good business partner for you. Again, this is particularly important, I think, in the mobile industry because the prevailing practices, quite frankly, just do not protect privacy and security. And so it's your organization's reputation that is at risk if you don't do your homework and make sure that contractually you're building in the safeguards. So that includes making sure you've got good contracts. That includes business associate agreement language when that's required. You've got security requirements baked into those contracts, and you know that the developer is, again, not sharing data outside the zones of trust that they really should be sharing it. And also you need to make sure that you're looking at the marketplace. There's a lot of corrupt apps that go out there, so you may have an app that you're using, someone creates malware basically using that name, so you need to monitor the marketplace to make sure there's not illicit copies of apps out there that could really damage your own brand and reputation. User education, again, as consumers get more involved, they become more responsible for managing some of their own data. But of course, consumers may not be very well versed in these things, so consumer education becomes important. Again, that would be things like a strong password on their device to protect any data that they store locally. So this is a part of, I think, an overall mHealth strategy you need to think of. What's your consumer education around privacy and security? And so as you go about managing these things, obviously you need to be a framework for managing your privacy security risks. That includes, again, sort of understanding the different regulatory standards that are out there, HIPAA, GLBA, PCI, state security breach notification laws, FTC, all these things you need to understand that, document that as part of your information governance. And of course, you all know this, but breaches can be very costly in terms of your overall brand. I think there was one breach that Blue Cross Blue Shield of Tennessee just had where it's costing them $20 million, half of which is just to try to figure out whose data was actually a part of the breach. So you may end up with a very costly situation even in just the investigation portion of it, let alone any fines and breach notification, credit monitoring costs. And under, of course, the HIPAA security rule, a part of everything is making sure you do a risk analysis. This, again, is still surprising nowadays how many organizations still are kind of whiffing on this fundamental piece. They're doing all kinds of very good safeguards to protect data, but they miss out on that foundational piece of doing their risk assessment. And of course, if OCR comes in and audits and they find that you haven't done a risk assessment lately, you're going to get dinged just because you haven't done that foundational piece. So as you go to do new things like mHealth types of initiatives, you have new risks, right? So you need to make sure that that gets incorporated into your risk assessment. And was discussed earlier, you might remediate some of those risks. Some of them you might ultimately decide to accept, but you need to document all that. And so just in conclusion, I thank you for all of your time. Appreciate your attention. And Shri, do we have a few minutes for questions? Okay.
Okay, so in your current role in charge of security, privacy, and compliance in Molina, what are the key initiatives which you think are important and you're taking?
Okay, was everybody able to hear the question? Okay, yeah. So just again, key initiatives at Molina in terms of privacy and security. Really a key one from a security perspective, we're implementing a DLP program, so that's really going to help us. With our data management, give us a tremendous new tool on that. We always have new educational initiatives that we're involved with, making sure the users are refreshed in terms of HIPAA, so that's something we'll be doing. And then, like everybody else, we're also waiting for the High Tech Act regs to be issued. So we would expect to see those, sometime in the next few months. And once those are published, we'll be kicking off a project to implement those. We are already, starting with that process. In particular, the high-tech regs have really big changes for business associates, right? So business associates under high-tech becoming directly subject to HIPAA regulations, and the proposed high-tech rules take it from the first tier vendors, being business associates, all the way down through the end tier. So we're currently looking at our business associates now, making sure we have updated information for them in anticipation of amending, renegotiating contracts with their business associates, and really just getting better control over our business associates.
Thank you.